Hello, everyone. Today I went campaigning again for Representative Ranson, um, like yesterday. And so today I'm going to be speaking about Trish Ranson on healthcare. So hopefully I'm not going to have the same problems I did yesterday when, yay, I didn't have the same problems going to the browser. Okay. Here is Ranson on improving healthcare in Oklahoma. By passing Medicaid Expansion on June 30th, Oklahoma voters secured health care coverage for at least 200,000 other neighbors. I'd like to extend a personal thank you to the people of Payne County who voted yes by a resounding 57 by 43% margin. I was one of those people. I supported full Medicaid expansion as the best possible step toward meeting the healthcare needs of uninsured Oklahomans while helping boost our state economy. Expansion. When the law takes effect in July 2021, it will benefit our state in many profound ways. More than 200,000 Oklahomans will gain healthcare coverage, many for the first time in their lives. Hospitals, including Stillwater Medical Center, will see significant reduction in uncompensated care cost, saving millions of dollars every month. This should reduce healthcare costs for all of us. Some rural hospitals and clinics will no longer be forced to close because of debt. Additional facilities for hospital or care. Billions of our money will be ours to reinvest in related industries will be created in urban, suburban, and rural communities across the state. Funding options. Oh, you gotta love this topic. Federal funding, or federal government, funds 90% of Medicaid expansion cost, and the state funds 10%. As recently as May, 1% projection of Oklahoma's portion for 2020 was $164 million. In the 2020 legislative session, two measures were passed to fund Governor Stitt's Sooner Care 2.0 Medicaid plan. He vetoed them when he scrapped his own plan. Both will again be available in the 2021 legislature as ways to fund expanded Medicaid without raising taxes or cutting other parts of the state budget. Supplemental Hospital Offset Payment Program, or Oklahoma Senate and House voted to increase the SHOP fee, which many hospitals already pay to help fund Medicaid, from 2.3% to 4%. The measure would generate approximately $134 million. State Question 814. Also in 2020, a joint resolution was passed putting State Question 814 on the November 3rd ballot. As a constitutional measure, it could not be vetoed. In November, voters will decide whether to modify an existing amendment of the state constitution by changing the allocation of money received under the 1998 Master Settlement Agreement. Each year, tobacco companies pay a settlement of roughly $75 million to Oklahoma. Currently, 75% of this payment is deposited in a trust fund that the legislature has not permitted to touch, while 25% goes into a fund that the legislature can tap. State Question 814 could flip the percentages, making an estimated $56 million per year available to fund Medicaid. More to be done. Ugh. Even with passage of Medicaid expansion, roughly 350,000 Oklahomans remain uninsured, and the number is certainly higher as many people who lost jobs during the coronavirus pandemic also lost health insurance. Securing coverage for all, of course, must happen at the federal level, and I am convinced now is the time. We are the only developed country in the world that does not provide health care coverage for all its citizens. In the year ahead, I and many of my colleagues will urge Oklahoma's congressional delegation to wholeheartedly support universal coverage efforts. If there is one thing the coronavirus pandemic has demonstrated with absolute, oh gosh, I'm going to mispronounce that, absolute clarity, it is that the United States needs universal health care coverage and a robust, functioning, science-based national public health infrastructure. I guess that's two things. Information on Medicaid's options was found these pages of, and you can go on, found these pages of okpolicy.org, and you can go to ransonhouse34.com/healthcare to click on the web links to find the two estimates and find out more information on the Medicaid expansion and everything. Going out and campaigning, I got to talk to my wonderful best friend from Rose State because I wanted to call and check on Jennifer and everything. So, and by the way, also shout out to the class of 2003 from Rose State, to all my classmates and everything that I graduated with from Rose State. And yes, we had a wonderful graduation night running from the tornado and everything. But the most awesome thing from the campaign trail was I got a clarinet. We walked by, when we went to one of the houses, there was this couple and this guy, and I told him that prior to my brain injury, I played a clarinet and everything. So I told him that in high school I played clarinet, and I was, besides the fact I had a beginner guitar that I was trying to learn how to play, but because of my left hand that has partial paralysis, it's kind of hard to learn. I've got to get like keyboard to loosen or something like that, the spasms and everything. But I was also wanting to relearn how to play the guitar, or not guitar, clarinet. And so his beginner clarinet, and it's now mine. So yay! I got a clarinet again. So I hope you all are doing wonderful. I'm doing good because I got a clarinet.